This is the trachea, the thing with all the rings on it, okay? When you follow it up underneath the jaw, it'll get wider here, okay? And when it gets wider, that's the larynx, right there, okay? And I'll have it even pulled back further tomorrow, but I just didn't have time to do it. Now, underneath the larynx, there'll be a muscular tube. That's the esophagus right there, okay? We follow that down, okay? And she did a pretty good job on this one. This is actually part of the superior vena cava right there. But anyway, you follow that all the way down to the heart. Now, when you get to the heart, I'm trying to see if she's done it on this one. Yeah, she has. Anyway, when you get to the heart, okay, there's the lobes of the lungs on the outside here, okay? Now, there will be a flap of tissue right over top of it. That's the thymus. And then there will be, it looks like a little baggie, a plastic baggie around it. That's the pericardial sac, okay? Now, for the bronchi, okay, if we remove the heart off the front, this would be sitting here. Here's the lungs. This is the trachea. These are the bronchi that branch off of it. So any of the branches off, those are actually the bronchi, and we'll have that cleaned up a little better too, okay? But you can see that there where it branches, okay? All right, and then inside the heart, where did I put that one? Okay. This is the heart, okay? And this is the front, and that's the, we lost part of it. Actually, this is the front. This is the apex, okay? And then there should have been an auricle right here, but that's gone. And when we open that up, okay, we're going to see that the left side has the red in it, okay? The left wall is thicker. This is the left ventricle, this is the left atrium, and this vessel, this big vessel coming out of it here, and here is the aorta, okay? Coming in, right here we have the superior vena cava, the right atrium, and then the left atrium. Actually, that's the pulmonary artery. Anyway, you can see most everything from that, okay? All right, now continuing down, right here between the two, we have between the thoracic cavity and the abdominal pelvic cavity, we have these walls of muscle. That's the diaphragm, okay? What is this structure here? Liver, okay? There's multiple lobes to the liver, and it's hard, okay? Between, basically right at the very top towards the left, there should be a squishy structure right there. That's the gallbladder, okay? And you see how it has a different texture, okay? And if you follow the gallbladder down underneath, there's a bile duct right there, but that's the bile duct right there that connects to down from the gallbladder. Okay. All right, now underneath the liver, you have the stomach. Okay, and the stomach has some yellow tissue right here in the bend of the stomach. That's the pancreas, and then also this yellow tissue right here. This is actually one of the better pancreas that you see right here. Okay, if you follow the stomach up, that's the esophagus. So what sphincter is there? Cardiac sphincter. Okay, you follow it this way, and where it connects to the intestines right there. And actually, I bet you can follow that. See, this is the where did the bile duct go? Bile duct's right there. But anyway, follow the bile duct down to the small intestines right there. But this is the what sphincter? Pyloric sphincter. Very good. Okay.
And that one connects to the
small intestine. And that's how I can tell you small intestines and large intestines is just if it's close to the stomach, it's going to be small intestines. If it's close to the rectum, it's going to be large intestines. So this would be the rectum, and then this is large intestines here. Okay? All right, and then underneath the stomach, you have the spleen. Okay? We don't have an appendix, or at least we don't find it so small. Now then on the back wall, I think this one's been removed on that side. Yeah. There's the kidney. Okay, and you can see that yellow white tissue right on top. That's actually the adrenal gland right there. Okay. And if we, I think I have one right here. Okay, I'll find I'll show you all that later. All right, and then if you go down from the kidney, you should have the, right here, and I'll pull all this back by tomorrow, okay? That's the ureter right there, that tube that's laying over my finger, okay? So you got to know where you're talking about. There's a lot of tubes, but if it's going from the bladder down to, from the kidney down the bladder, okay, it's going to be the ureter. Now, this right here is the, what am I saying, bladder, okay? Above that, okay, you have the two fallopian tubes, and then they form a little Y structure right here. Okay. So, yeah, those two form a Y structure. That Y structure is the uterus. And you actually can follow the uterus further down. It does get a little wider. Now, if you follow the fallopian tubes up, then in here, there it is, okay? The brown tissue between my fingers is the ovary right there. Okay, it's not the yellow stuff, and if you follow it this way, again, this one's ovaries are not great, actually, but that's actually part of the ovary. This ovary is a little messed up from when we did it, but that's the ovary too, okay? And that's most of it. Now you have, obviously, biceps brachii, which is here, triceps brachii, which is here, masseter muscle, that kind of stuff, okay? Before we run out of time, let me make sure I do the male side. Again, you know, we saw everything about the same. Kidney, okay, if it's divided front and back, the middle part that is darker, that's the medulla. The colored part or lighter part around the outside, that's the cortex, okay? Now, all right, so here we have, all right, obviously we have the penis, okay? And it can be pulled, the skin will probably be pulled back where you can see it even more as far as that goes, okay? Underneath there, you have the two testes, that's one, and then I think the other one has either been removed or, yeah, they removed that one, that's great. But anyway, this is the testes right here, okay? This is the vas deferens going up, and you can actually follow it all the way up to the urethra, and then right. This structure right here, that structure right there is actually the epididymis. Yeah, this is not a good one to find the epididymis on, but it is there. Basically, the epididymis. This is the epididymis, but it connects up like that and lays all the way up over around the outside. Actually, that may be it. I think that's it. Yeah, just can't see it very good. All right. Any questions? All right. So the biggest thing is just go over stuff at home, but basically I'm done. So, as far as that goes. Anybody have any questions?